Hello and welcome to the fourth session of Compass 22.2. I hope you're enjoying the day. My name's Carl Towner and I'm from Nottingham University Hospitals in the Midlands. As Joe said at the first session, please do give us your feedback. This is really helpful. So thank you for that. In terms of practicalities for this session, there will be time at the end for questions and answers, but Paul is very happy to take questions during the presentation if this really helps. So we'll monitor the question feed and feed those into the session as appropriate. So let me just introduce our speaker for this session. I'm absolutely delighted to introduce to you Paul Gilliatt, who is currently Programme Director for the NHS Frontline Digital Programme, which Paul will share with you in a moment. This programme could be described as one of the three big digitisation bets currently being pursued for the NHS, and it is involving big money, 2 billion to be precise. Paul joined the NHS back in 2009 and could be described as, sorry Paul, a die-hard digital doer. And comes, I couldn't resist that, and comes to us with a back catalogue of delivering digital programmes. Just to give you an idea, I was chatting to Paul a couple of weeks ago, just sort of delving into his past, and to give you an idea of the calibre of expertise that Paul brings to the NHS, I'll share with you the fact that he's come through the IPA's Major Project Leadership Academy, and he continues to serve as a high-risk gateway reviewer for the IPA. And Joe mentioned the IPA as a key player in everything we do in the NHS. So that's a really key link. And I am going to throw in a little piece because it's good to encourage, and that is Paul is also a mental health first aider. So without further ado, let me hand you over to Paul. And I'm really looking forward to your presentation on Frontline Digitisation. Over to you, Paul.
Great, thank you so much. People hear me okay? All right, is that done? Let me know if that happens again. Yeah, thanks so much for that intro. Die-hard digital doer. I'll have to update my CV with that. That's my job title. Delighted to be here today. What I'm going to talk to you about is the Frontline Digitisation programme, which is a programme that I'm leading within NHS England and the wider NHS. As you heard, it's one of, I guess, three big bets in the digital transformation space. The others being the whole data for planning and research space, and also the NHS apps, so sort of citizen facing tech. We are currently a £2 billion programme, still subject to sign off by Treasury, but we're looking to invest 2 billion in frontline organisations across England over the next 3 years to support them to reach a core level of digital maturity. And as I come through, I'll talk about why we're doing it and why that's important. So first slide here, you can see our vision there. So ultimately, this is about making sure that we deliver the best patient care as possible, and that clinicians have the right digital tools to deliver that care. More strategically, having a digitized frontline is a sort of core building block for a whole range of things we want to do to transform health and care. We need it to be able to integrate services across providers. Has that come off the screen again? Hopefully that's fixed it. We need it to be able to drive better data for planning, research, population health. We need it to be able to give citizens access to and control of the health and care data. So that's why so much emphasis and importance is being placed on this programme by NHS England over the next 3 years. It really is getting the sort of basic digital building blocks in place in the NHS to support the broader transformation of the NHS. I guess another key sort of word on here is levelling up. So as you'll see, hopefully on the next slide, we've got quite a patchwork of digital maturity across the NHS in England at the moment. There are a number of organisations who are digitally mature and indeed up there with the world's best in terms of digitally enabled healthcare providers. But there's a far greater number of organisations who aren't yet at the level of maturity that we think should be standard. And indeed, there's some organisations that are really still operating at quite a low level of digital maturity, lots of different systems, and indeed paper still. So a key ambition of this programme is to level up digital maturity across the NHS in England. The little diagram on the right there is just a nod to our What Good Looks Like framework, which is a framework to help local organisations get the right elements in place to support successful digital transformation. I've got a link at the end of the slideshow where you can go and find out more about the What Good Looks Like framework. So rather than me explaining why this is important, I've thought I'd share a quick video. It actually dates back to the Global Digital Exemplar programme, which is in a way, which is a sort of forerunner programme to what we're doing now with the Frontline Digitisation programme. But you can hear from NHS colleagues on the front line as to why having the right digital technologies is so critical to deliver the best patient care possible. Hopefully someone will now play the video for me.
Every patient in every ward is observed at a regular interval of time, and the staff are spending a long time filling in forms, walking around with clipboards.
We've seen a big folder that you kind of had to lumber up and down the ward with you.
If you wanted to trace out the previous information, it's really hard to find out the paperwork.
So what we wanted to do was actually provide something technological that would directly impact and improve the work of the inpatient staff.
We'd have to trawl through hundreds and thousands of pieces of paperwork, whereas now we can pull that data in minutes.
Tablet, it fits nicely in your hand, or if you get like a smartphone type device, easier to fit into your pocket.
Anybody can do the observation at any time, and it can be recorded, so it's much easier and much prompt and accurate.
It is ultimately the patients at the heart of all this. All that we're trying to do is to improve the quality of care. And I think if the staff have got tools that suit their work and help them do their work well, that can only be a benefit to the patient at the centre of it all.
Get care plans and updates and also pictures of service users.
I can't see why anybody wouldn't want to take this on, because ultimately it gives you a system that allows nurses to do their job in a more efficient and effective way. It means we can identify a patient whose physical health is deteriorating and do something about it quicker. And it also means that we can pull this wealth of data, millions of pieces of data that we've never ever been able to pull before, which can only therefore, moving forward, make patient outcomes better.
This programme isn't just about the 7 mental health trusts with the GD's data, it's about everybody. And I'm really hoping that a lot of the lessons we've learned, the work we've done, can be applied more broadly and other people get value from it. And that's true, of course, for all the blueprints, not just this one. I'm hoping that by looking at the blueprint and looking at all the work, right from the outset through to delivery, this can inspire other people to see that this can be done. It's not an impossible task. And then here's an outline of steps to show how you could do it for yourselves.
Great, thank you. So that was just a brief video to demonstrate why we're doing that. That's clearly one story there from the work that we did with the Frontline on the Global Digital Exemplar Programme, and through the Frontline Digitisation Programme, which I should maybe set some context around that. So a few years ago, there was a review called the WACTA review that suggested that to digitise the NHS, we should do that in three phases. So the first phase was about selecting a small number of organisations who were already relatively digitally mature, and working with them to get them up to a world-class level of digital maturity, and to develop lessons and blueprints from that to then enable other NHS organisations to follow. The second phase was indeed about fast followers, so about getting, I guess, the wave of organisations who are then ready to follow those global digital exemplars in reaching a core level of digital maturity. And we're really on to the last phase now, which is supported by the Frontline Digitisation Programme, which is trying now to get the rest of the NHS up to that core level of digital maturity. So I hope that the video you've just seen over the next 3 years to generate another sort of 150 stories like that in terms of how we're rolling out digital technology that really improves the experience of our staff and the care that our patients receive. So the chart on the right shows in very simple terms the current landscape, and we rather crudely categorized the 200 odd NHS trusts in England in terms of whether they're at or above a core level of digital capability. That's the green sector of that pie chart. You've got 49 trusts there. Whether they've got something, but it's not quite at the level that we'd expect in terms of a core standard, and that's the biggest proportion there, that orange proportion, 133 trusts. And then the 30 trusts who really don't have any level of, or a very limited level of digitization. So our ambitions on the right, the first is around coverage. So we want every NHS trust in England to have an electronic patient record by March 2025. So to meet that coverage ambition, we need to work very closely with the 30 sort of trusts in the red proportion of that pie chart, to get them to implement, to help them to implement an electronic patient record over the next 3 years. Those 30 trusts are all at a different stage in the journey, all have a fairly unique set of circumstances that have meant they haven't to date got to a sort of key level of digitization. So some of them were supporting right through the journey, from developing a strategy, running a procurement, into implementation. Some are already on the way. Our second ambition then on the left there is around capability, which is really focused at the orange part of this chart. So you've got the 100 NHS trusts who've got some form of electronic patient record, some level of digitisation, but it needs extending to meet our core standards. And I realise I mentioned the word core standards probably about 10 times so far today without saying what I mean by that. The team has developed what we term the minimum digital foundations, which are a set of different digital capabilities that we think every NHS trust needs to have in place. The link I share at the end of the presentation will is where you can go and access those minimum digital foundations. And for those on the call who are familiar with the HIMSS framework, so HIMSS is a sort of international digital maturity framework which has 7 levels. Our minimum digital foundations are broadly approximate to HIMSS level 5, level 0 being the least mature and level 7 being the most mature. So our first ambition is about helping the 30 trusts without any form of electronic patient record to deliver one, therefore giving us coverage across England. Second one is about helping every trust who's not at that core level of digital capability equivalent to HIMSS 5 to reach that, which is really focused on working with that 133 trusts in the middle. And then the final ambition, which is a developing piece of policy at the moment, but with the formation of ICSs and the emergence of provider collaboratives, encouraging providers when they're putting in digital technologies, not just to look at their individual requirements, but actually to look at how they work with other partners in their integrated care system to deliver integrated care to a population, and where potentially converging on a smaller number of digital platforms would help them to deliver that integrated care. As I say, we're developing some policy in this space. We're actually about to go out and engage the system on that policy ahead of a more formal consultation. But given the investment we're making over the next 3 years, we are encouraging all providers to look not only at their sort of local, their individual provider requirements, but also their broader system level requirements when they're planning these projects. And I also should have said at the start, I hope, and maybe I should have done a little poll, but given that nationally in the digital transformation space, this is, well, I'd argue our highest priority, but certainly the highest level of the greatest level of investment we're making in any program over the next 3 years. Hopefully there's a number of people on this call who are involved in some way, whether at a national level or in the regions, or hopefully working in frontline organisations on some of these digitisation projects. The next slide, I won't read everything on here, but this covers our main strategic objectives as a programme. So we want, we certainly want every organisation to have an electronic patient record by the end of the programme, but more importantly, we want all of those digital capabilities to be at a core level. It's quite challenging because if you cast your mind back to the previous graph, only about 20% of the NHS of NHS trusts are digitised to the level we'd expect, and that's taken a couple of decades. So what we're effectively trying to do is to get the remaining 80%, a number of which really are at the start of the journey, up to a level of digitisation in 3 years. So it's a very challenging ambition, and as I'll come on to later, will require a sort of system, a whole system approach to deliver. There's a key piece of the programme which is working with the supplier marketplace. So both the suppliers of electronic patient record solutions, of which we've got around 15 predominant suppliers across the NHS, but also the whole sort of supporting ecosystem, so professional services suppliers who help with consultancy or doing technical activities like data migration or system integration and business change and so on. So there's a big piece of the programme around working with the marketplace to make sure that they're responding to the needs of the NHS. And this isn't just about delivering digital technology over 3 years. It's about making sure that the NHS organisations have the capability in place to manage ongoing digital transformation, because none of these organisations are going to want to get to our sort of base level of digital maturity and then stop. Digital transformation is sort of part of the business of providing health. So this, as much as anything, is about building capability locally in providers and ICSs to continue to deliver digital transformation over time. So I think this is my penultimate slide, but recognizing we're with a sort of project delivery audience here, in delivering a major program like this, you need to take a whole system approach. So we need to leverage every part of the NHS and also the sort of broader supplier marketplace that I've talked about if we're to successfully deliver the ambitions I outlined earlier. I still like to say the main effort of the Frontline Digitisation programme is to support local business transformation. That's where the change's happening. That is where we're pushing the bulk of the 2 billion funding that was mentioned earlier. The 99% of that will be pushed out to integrated care systems and providers, but we do need a level of programme governance and orchestration in the centre, and there are certain things that it makes sense to do centrally rather than at a local level, and the piece I talked about around managing the marketplace obviously is best done nationally. But although that's not to say that individual providers and integrated care systems won't have relationships with the people and contracts with the people who are providing their digital services. So our main efforts to support local business transformation, we're very much looking to leverage the capabilities across the NHS Transformation Directorate, which includes NHS Digital, and indeed the wider NHS England, working in close collaboration with the 7 regional teams, so the clinical teams in the region, the finance teams in the regions, the digital teams in the regions, and also other national policy teams like the digital mental health and the digital community teams. We're not looking to build an army of people in the centre. Most resources need to be deployed on local business transformation projects, and that's where the bulk of the investment will be made. But as I say, there are certain things that it makes sense to do centrally. One is a piece around engaging nationally with the supplier marketplace. Another is around having a sort of support offer in place, so that we're able to in fact, I'll talk a bit more detail about the support offer that we want to put in place. It's got a few elements to it. Firstly, we want to provide much better information online that providers can access in terms of best practice and guidance. And we've got tons of that information. It's just about presenting it more seamlessly to local organisations who are going through running these digital transformation projects. And the link I'll provide on the next slide is through to our online support hub. Secondly, is about providing subject matter expertise in a range of topics, business change, clinical safety, data migration, to name a few. So we will have a small team of, or we do have a small team of subject matter experts that can work with systems and trusts to provide advice. So this isn't about putting people into trust project teams to do the work, but it's about providing advice where it's needed, and running things like masterclasses and so on. We are offering project health checks or gate reviews, very similar to the Infrastructure and Project Authority gate reviews, to some of the more complex and high value local projects, with an ultimate aim of helping the local project teams and sponsors maximize the chances of success of those projects. We're looking to foster peer support networks across the NHS. So the real expertise in doing digital transformation locally, as you would expect, is out there in NHS providers. So this is about making sure that one trust who's maybe been through the digital transformation journey, maybe one of the global digital exemplars, can work with other trusts who are still on the journey and provide them with support. And then last piece, there's a digital graduate program that we're supporting with funding. So where systems are putting digital graduates on these digitisation projects, we will be helping to fund those digital graduates over the next 3 years. So sort of suite of things we're doing centrally to support local business transformation. And of course, we need to have a level of programme governance and management appropriate for a £2 billion investment. So we're well up there on the government major project portfolio. We're subject to a lot of political and public scrutiny, as you'd expect. We have to work closely with colleagues in Cabinet Office, Treasury and the department. So we need the right level of governance and management and assurance in place to provide the assurance that we're driving the maximum possible value from £2 billion of taxpayers' money. So thanks for bearing with me this morning. I hope we can move into a bit of a Q&A now. I did promise that I would share the link to our EPR community of practice. It's on there. It's part of NHS Futures, which anyone can subscribe to. Hopefully people are already. We're using that to bring people together who are working on these sorts of projects across the NHS, to signpost events, to provide the sort of best practice guidance that I talked about. It's part of the wider What Good Looks Like hub that I also talked about earlier. So any of you out there who are involved in or interested in these sorts of projects, then I'd encourage you please to visit and sign up to the hub. So I will stop there and open it up for questions.
Thank you so much, Paul. That's been a real insight. I know from my personal involvement at Nottingham, there's a lot I'm working with digitalisation patient records, and not only looking at improving the position, but as somebody that is involved in exercises to try and get information out of patient records. It's going to, it's very relevant. We do have some questions, so I'm going to start firing them at you. The first one is, what are the metrics that are being used to measure or categorize digital maturity? And there's a little rider to this, and also, does the Frontline Digitisation programme include social care? So first of all, what's the metrics that you're using to categorise maturity? And then I'll ask you about the social care.
Great, those are wonderful questions, actually. Luckily, I know the answer to both. So there are digital maturity frameworks out there. I referenced the HIMSS framework. We're currently in the process of we're out to market for a digital maturity partner who will help us to design and implement an assessment across NHS trusts in England. So we're hoping to run appoint that partner and then run an initial assessment before the end of the year, so in the autumn, and then we might run a more tailored assessment next year, and then we'll probably come back and run a further assessment in 2025. So we will be designing, rolling out a digital maturity assessment across the NHS trusts in England later this year, and then we'll revisit that at a couple of points over the next 3 years. And really, for me as a programme director, that's my KPI. Have we delivered a step change in digital maturity from where we are now to where we'll be in 2025? So that was the first.
And does it extend to social care?
So there is the scope of the Frontline Digitisation programme doesn't include social care. It's around NHS trusts providing ambulance, community, acute and mental health services. But there is a sister programme which doesn't sit in NHS England. It actually sits in the Department of Health and Social Care, called the Digitising Social Care programme, which is very similar. It's looking to work with the supplier marketplace around the social care equivalent VPRs, and also provide funding out to social care providers to help them to digitise. So Peter Skinner is my counterpart on that Digitising Social Care programme. He's the programme director, and that programme's run out of the Department of Health and Social Care.
So just out of curiosity, since we're talking about digital maturity, and I know it's not a competition, but you talked about some exemplars in the first wave. What kind of level of maturity are they sitting at? If we're aiming at 5, where were they?
Oh, that in most cases HIMSS 6 or 7.
Brilliant. Yeah, so they go beyond. Yeah. Okay.
Oh yeah, yeah, and I mean, we've clearly we'd like everyone to be at sort of that equivalent to HIMSS 5 level in the next 3 years. I think that's a tall ask because people are starting at different points. So the phrase I use is we're looking to deliver a step change in digital maturity. I mean, the best way of predicting the future is to look at the past, and if it's taken 2 decades to get 20% of the NHS digitised, then clearly to try and do the remaining 80% in 3 years is probably pushing it too far. But that's not to say we shouldn't have lofty ambitions. And indeed, we'd hope that providers will want to continue that journey and work up to even higher levels of digitisation. And there are NHS organisations who have done that, including organisations that we work with through the GDE programme.
just to throw on about pace of change, then COVID has been, has come along and made possible things that were being told that were impossible to do in certain cases. Has this been relevant for you for this agenda, or has COVID been a help or a hindrance?
Well, again, I've only been in this post since January, so I guess I wasn't. I can't comment on when we were actually in the pandemic, although actually I've been in the NHS during that time, so I probably could. It's a bit of it's a blessing and a curse, isn't it? So certainly, I'd say broadly in terms of digital transformation, it did accelerate things. Where it's more challenging is to do this, to digitize a frontline provider is a huge and complex business transformation project. It affects every person working within that provider organization, and clearly both through COVID and now the NHS remains under huge operational pressure, and it is very difficult to deliver business transformation when you're essentially firefighting day in, day out, and trying to keep the lights on and deal with that operational pressure. So it's by no means an easy time for organizations to be trying to do business change on this scale, and we need to recognize that really, and provide the money, provide the support we can, but also importantly make sure that local organizations are going at the pace that makes sense for them, and that they're ultimately delivering successful projects that don't adversely affect patient care.
Sure. Can I move on to the next question then, which is possibly a bit more tangible and techie? You talked about engaging with the supplier market. We've got a question which is: has there been a discussion on which EPR systems will be deployed to trusts and integrated as such? And similarly, are you specifying, or to what extent are you specifying acceptable or compliant EPR systems, or is that not something you're trying to limit, control, influence?
These are all good questions. So back in the day, the early noughties, there was something called the National Programme for IT, where the government's approach at the time was to sort of try and roll out centrally contracted standard systems across geographies, and there were 5 geographies initially, and it wasn't a great success for a number of reasons. At the time, the systems weren't there, but also because it was top down and centrally imposed, it didn't really get the level of, it didn't get the buy-in from NHS organisations. So we definitely don't want to go back to and repeat the mistakes of the past and try and sort of centrally impose what systems people should be buying and implementing. And the markets, another side effect of the National Programme for IT is it really sort of constrained the supplier marketplace and innovation in that marketplace for a number of years. The market's bounced back somewhat from there, and there are a number of suppliers who provide these products and services, and our firm policy is that local organisations determine the requirements that they go out to market with, and they So we specify that local organisations need to run open competitions using one of two frameworks, which have a number of suppliers on, and ultimately those open competitions will determine what the best product is for each NHS organisation.
So is it fair to say then on that, you're publishing process, expected process and expected principles, but letting the local execute, the local expression of that?
So we've got our minimum digital foundations, which organisations can use as a sort of base in terms of requirements they should be aiming for, recognising they're all at different starting points. We're saying they need to run open competitions, they need to use existing frameworks, but the ultimately those individual local competitions will determine which supplier is and which EPR is deployed in which system or provider. And I mean, we need to use the full capacity in the marketplace.
Sure.
There isn't a single EPR supplier who could deliver across the NHS in England.
I'm going to press you on. We're getting a rush of last minute questions, so I feel challenged that we're going to get rattled through this. But I'm going to quickly now, if I can just extend that then. So this is possibly more of a comment than a question. We are the merged trust with health and adult social care combined under our service offer. Feedback from our staff consistently points to the lack of interoperability between health and social care EPRs being a headache. Are you aware of any efforts from the system providers to plug the interoperability gap? And I suppose extending what you've just said, in terms of your minimum viable product, effectively your minimum standard, is there any interoperability that you are expecting as a minimum between what's happening within NHS and so on?
Absolutely. Interoperability is key across care settings and between health and social care. Under the programme, we have got a piece of work around defining the standards for EPRs and then making sure that we engage with both the NHS and suppliers on those standards, and then actually looking to sort of bake those into procurements, contracts, etc. So
to extend that one,
we haven't got all the answers there, but we are on it.
You mind it? Well, in a sort of almost similar vein, another question for those trusts that are on the border with Wales and handle Welsh patients. How do the digitised patient notes get provided back to the primary healthcare provider, e.g. a Welsh health board for a Welsh patient? This also needs to flow the other way, as we have already digitised inpatient adult nursing notes across Wales. So how is that all embraced within this initiative?
Well, there's another sister programme. I mentioned Digitising Social Care, Frontline Digitisation, which is a shared care record programme. What I have to confess, I don't know the answer to that. But
okay, well, I'll leave you with that one and ask you another one.
Okay, I'm finding the answer. So I am gonna. John Farrington is my counterpart on shared care records, and I will find out from him how the sort of England, Wales, and I guess the same for England, Scotland border issue is.
Sure. It's kind of interoperability. I'm going to move you back to your point about local implementation. So if that's the key, is local connection, a couple of connecting questions quickly. One is, how are you contacting the 30 trusts with no EPR?
So in my team's structured, I have a number of people aligned to each region, who then have relationships with the ICSs and providers in those regions, and we work closely with the regional teams as well. So we we have an engagement line into not just the 30 with no EPR, but also the 130 odd that have got something that isn't at the right level, and some of them will be extending what they've got, and some will be looking to replace what they've got. Additionally, for the 30 without an EPR, we've actually run a number of exec sessions, and Tim Ferris, who's the National Director of Transformation in NHS England, has now met with most of the chief execs of those organisations, and we will be providing more money and more support to those 30.
Sure. And I assume that on the flip side, there'll be somebody within each trust that is the champion or key point person. So I'm going to be seeking that person out for Nottingham. I'm assuming that's how there will be somebody on each trust side that oppose your guy or girl.
Yeah, although I mean, this is really, digital transformation is something that should be considered at a trust board level.
Yeah,
and it's not delivered by one person. I mean, these projects will have a sponsor. And sometimes it will be the CEO, might be the COO, might be the CFO, etc.
Sure.
But you really need everyone in the board and everyone in the trust exec team to be championing digital transformation. And the most important thing is clinical leadership for delivering these projects.
Sadly, we have just run out of time, but what I'm going to do is just try and do my best to wrap up the remaining questions in there. I mean, we will try and get back and publish sort of questions that we missed. There's a couple of questions around the convergence element and the convergence strategy. There's interest in terms of when will some of these things be published? You know, when will this kind of information be made available on your website? Just quick answer. Roughly when is that kind of stuff going to come out?
On the convergence piece,
yeah.
So the engagement around convergence, we're actually just waiting for a Secretary of State sign off on the approach, and obviously the Secretary of State changed yesterday. But I'm a bit, I keep saying it's imminent, but it will be out, I hope, by the end of the month at the latest to engage.
Right,
around.
So really soon. Fantastic. One little plea, I'm just going to throw this in as a, it's phrased as a question, but it sounds more like a plea. How can we feel assured that innovative procurements are supported rather than just having same old? But I think you've kind of implied that nobody's going to be boxed into same old. Local procurement, and you can be as innovative as you like, providing you're meeting the requirements. And I'm going to finish with one last question, and I suppose the actual question was, how can the HPCA, that's now that we exist, support the project and change teams across the community that are implementing frontline digitisation? So perhaps I could rephrase it and saying, if you could have one wish for us as the healthcare project and change community that would help you be successful in leading the digital transformation program, what would that one wish be? You've got
collaboration. So I mean, that's what's great about communities like this. So yeah, ultimately there'll be people in this community who've done this and know some of the pitfalls and some of the answers, and there'll be people in the community who would really benefit from from understanding that. So I mean, that's what we're trying to do with the CPR community practice, and it's not just for project delivery folks, but we're hoping that sort of clinicians, CCIOs, CNIOs, etc. So it would be about, if you're involved in one of these projects, then please try and get involved in the community and sort of share what you're doing, what's going well, where you need some help.
Super, thank you. So I think probably I really have crashed the pips. But I think it's definitely been worthwhile. So the plea there from Paul is, if you're not involved, get connected. If you are involved, get collaborating. Don't be a stranger, don't be an island, and press this forward and do in 3 years what the previous 20% has done in 2 decades. There's the challenge. So sadly, we have run out of time. So just say a huge thank you to Paul for your time and for what you are fronting up on behalf of all of us across the NHS. A plea from me to everybody, please do give us your feedback. Do sign up for the new HPCA, and look forward to the next session. Thank you very much.
Thank you all. I'm back for the panel, by the way. And
yes, of course.
Find me at paul.gilliatt1@nhs.net.
Super. Thank you very much.